Everybody, today will be the another class of the osteology, and today's topic would be the ulnar, and we're going to continue the upper limb. And today we're going to discuss the general features and aspects and protrusions and all those kind of things of the bone, what we call as ulna. All right, so ulnar, as you can see here, is located in the antebrachium region, in the forearm region. So this is the forearm region, and it is there's two bones in the forearm region. So we have the ulnar and radius. So we need to know the exact positions of these two. So ulnar is always on the medial side, okay, and radius is on the lateral side. Don't forget that. And well, when we say medial and lateral, so it's like this. So the ulnar is located on the medial side of your forearm, and the radius is on the lateral side. What we say is that ulnar is located on the little finger side, okay, and the radius is located on the thumb side. Don't forget that. So ulnar, medial, little finger side, radius is on the lateral side, the thumb side. Don't forget that. Okay, so ulnar and the radius forms attachment of the elbow and forms part of the elbow joint with the humerus at the proximal end. On the distal end, ulnar, actually we're going to look at that. Let's look at this. We don't see the palm over here, but if we look at this skeleton, we'd see that. So this is the upper limb. So this is the arm, the humerus, and this is the forearm, the ulnar, and well, actually this is my right skeleton. Why? Because the ulnar should be located on the medial side, all right, and the radius, this is the radius here, it's on the lateral side. So if I put it like so on my left side, it won't fit. Why? Because now here we have the radius is on the medial side. That's not correct. It should be on the lateral side. So this is my right skeleton, or my right upper limb. Okay, so this is the proper position here. All right, so we have the wrist joint formed by the ulnar, radius, and the distal end of the humerus. And if we look at the distal part of the bones, the ulnar and radius, this is the wrist joint here, and it's primarily formed by the radius. So the ulnar, the head of the ulnar, does not directly participate in the wrist joint, although it's located in that area. And there's an articular, we're going to look at that a bit later. There's an articular disc. That articular disc contributes to the formation, but primarily the wrist joint is formed between the radius, the articular facet of the radius, and the proximal lobe of the carpal bones. So that's the wrist joint over there. Therefore, the ulnar does not participate in the wrist joint distally. And we're going to look at the ulnar in detail a bit later. So ulnar is a really peculiar bone. It's the structure and the shape of the bone is really quite different than the other bones, and it has a whole lot of attachment points for muscles and ligaments and those kind of things. All right, so we're going to look at them one by one. One other thing that we need to look at. So we have this elbow joint, which is a part of a synovial hinge joint. So we have the biaxial, we have the flexion extension motions here, we have flexion, and then we have the extension motions done around the hinge joint. One of the other thing that we also see in the forearm in terms of motions, pronation, supination, we're going to look at that because we have the attachment sites of the part of the ulnar and the head of the radius, and that allows the formation of pronation. So pronation is like so, like this is the medial rotation, that's pronation, and supination, coming back to the anatomical position, supination or lateral rotation. Okay, so this is basically, as you can see, the radius, this is the radius on the lateral side, moves on top of the ulnar, as you can see, distally. And the head of the radius here, the head of the radius basically rotates and this rotational movement is allowed with its circumference head, with the attachment of the radial notch on the ulnar. So there's a rotational movement of the head to allow the pronation function, pronation and supination function. So we're going to look at that a bit later also. And in addition to that, we have these interosseous borders, both of ulnar and radius, and interosseous border make up there's a fibrous connective tissue, what we call as the interosseous membrane, that covers this empty area here. But the small amount of area of the interosseous membrane is deficient above there, so we have the posterior interosseous vessel that passes above that, and then descends down on the posterior aspect of this membrane. So we have this posterior interosseous membrane that connects the radius and ulnar, and this is part of a joint, by the way, the interosseous membrane, because it is also regarded as a fibrous joint, and it's a syndesmosis type of joint, and we're going to look at that later on. Okay, so this is the ulnar. That's about it. So let's look at the ulnar bone now, independently, separately, then look at the individual features of the ulnar bone closely. All right, let's look at it now. Okay, hi. Now let's look at the detailed features and general extensions of the ulnar. So let's put it over here. So basically, this is the ulnar, and if we look at the what it resembles, let's look at it like so. So it's when you look at on the lateral surface, lateral side, you would see the ulnar resembles like a wrench. Okay, it has a hook on the end, and it resembles like a wrench. You know, I don't know if you know the wrench. You know, you put it on the screw, and you screw it, and then you turn it around. So basically, it's a wrench type of bone. It has, again, the upper end, the shaft body, and the lower end. Lower end is basically the head of the ulnar. Like I said earlier, don't expect the head to be located on the proximal side of the bones. Okay, this is in a regular bone. Yes, we do find head on the proximal aspect end, but here in the ulnar, the head of the ulnar is located at the distal end. Okay, so don't forget that. So the proximal end, the body and shaft, and distal end and lower end of the end, or the head of the ulnar is at the distal end. Okay, so this is how the ulnar looks like. All right. So let's look at the proximal end of the ulnar. Okay, proximal end of the ulnar, we basically divide this area into two important processes: coronary process, which is at the front, and then we have the olecranon process, which is located at the back. Okay, so this back portion is the olecranon process, and this front portion is the coronary process. And then we have two notches here. We have the trochlear notch, and then we have the radial notch. Okay, so this big notch here is also referred to as semilunar notch. So this is the trochlear notch, and this is on the lateral side would be the radial notch, where the head of the radius attaches to this particular area. All right. So after classifying that, let's look at these areas independently, one by one now. Okay. So let's look at the olecranon process. Olecranon process has certain surfaces. So we have the anterior surface, we have the superior surface, we have the posterior surface, and then we have the lateral and medial surface. Okay, the reason why I call this lateral surface is that always, don't forget, on the lateral side, we have the ulnar notch is always located on the lateral side. Why? Because the radius is located on laterally, and like I said earlier, ulnar is medially located. So basically what happens is, if I get this radius, so this radial notch always articulates or fits with the head of the radius. Okay, so it fits, so it articulates and attaches to the head of the radius, radial notch and radius, and therefore, so like I said, radius is located laterally on the forearm, and the ulnar is located medial in the forearm, which ulnar is where the little finger is located, and the radius is where the thumb is located. So what I mean is that the radial notch here is always located laterally. All right. So that's why I said that's why I said this small radial notch is on the lateral side. Okay. So this side of the let's just get to the olecranon. So I said this is the anterior surface. Okay. This is the the upper surface, superior surface. We have the lateral surface, and then we have the medial surface, and then we have the posterior surface of the olecranon process. Let's look at these surfaces one by one. So in the margins of the anterior surface here, the margin. Okay, let's look at this the anterior surface over here. So anterior surface is the smooth part of the olecranon process. This is the smooth part. All right. And it forms part of the trochlear notch. So we have the other part of the trochlear notch is over here. So this is the lower part of the trochlear notch, is the upper part of the trochlear notch. So this is whole part is the trochlear, this C-shaped structure. Okay, as you can see, it's also referred to as semilunar notch. And what happens is that attachment occurs with the trochlea of the humerus. So remember, this was the trochlea of the humerus. So the trochlear notch of the ulnar attaches to the trochlea of the humerus. All right. So that's a trochlea. All right. So that's the anterior surface of the olecranon process. Let's look at the upper surface, superior surface. In the superior surface, we have the edges. Okay. So the edge is attached. This line is attached by the capsular ligament. So the whole capsule ligament attached to the edges of the margins of the upper surface. And next to that, in the upper surface, we have an important attachment site or impression where the triceps muscle attaches. Okay, so triceps muscle attaches to this area. So remember, triceps, the origin of the triceps. Who can tell me the origin of the triceps? Okay, right, I can hear that. Yes, you're right. Is the inferior glenoid tubercle, right? Inferior glenoid tubercle, this is the origin of that muscle. It comes from the inferior glenoid tubercle. Where's the inferior glenoid tubercle? It's over here. Let's look at it. Okay, so this is, I'm sorry, inferior glenoid, yeah. This is the glenoid cavity here. This is the scapula, by the way. This is the supraglenoid tubercle, and this is the inferior glenoid tubercle. Supraglenoid tubercle forms the origin for the tendon of the bicep brachii muscle, all right? And the inferior glenoid tubercle serves the origin of the triceps brachii muscle. Triceps brachii muscle basically goes behind the humerus, all right? It goes behind the humerus, all right? And then goes all the way down and passes the wrist joint, all right? Passes the wrist joint and attaches to the posterior surface of the, or the superior surface of the olecranon process, all right? So it goes all the way down and attached to the olecranon process at the back. So this, when I say at the back, of course, I'm referring to olecranon process. So this is the front. This is the anterior part. So the olecranon, where you see olecranon process is at the back here. All right. So the triceps muscle comes from the inferior glenoid tubercle, goes all the way back from the backside of the humerus, and then attaches, as you can see, it attaches to this area here. This is the superior surface of the olecranon process. That's where the triceps attaches. All right. So this is the superior surface. This is the attachment point for the triceps muscles. Between the tendon attachment of the triceps and the margins of the capsular ligament, in between you have the bursa, synovial bursa, which separates these two apart. So that's the superior surface. Let's look at the posterior surface of the olecranon process. This is the posterior surface of the olecranon process. Posterior surface, as you can see, it's a triangular area here. You can see that it's a triangular area, and the importance of this area is that it's subcutaneous. What does it mean by saying subcutaneous? It can be palpated from outside. All right. So please, everybody can palpate their posterior surface or the tip of the olecranon. Let me show you this. So this, okay, when your elbow is extended, okay, this pointed area is basically the pointed part of the olecranon process from the posterior side, and you can palpate it. Okay, this is the sharp end of your elbow on the posterior aspect of the elbow. So this sharp end, the part that you can palpate, is this point here. All right, is this point here. All right. So going down to that point, descending backwards. So this is the posterior surface of the olecranon process. It's a triangular shape, as you can see. All right, it's a triangular shape, and it's subcutaneous. You can feel that. And the importance of this is that since it's really superficial, just beneath that you have a bursa. So you have bones, you have the subcutaneous connective tissue, and you have a skin. In between that, you have a bursa. This bursa is called the olecranon bursa. And sometimes this bursa, you see an inflammation of this bursa because of the friction that occurs in this particular area. The reason why there is friction is the people who, especially the students, would write and put their elbow on the table frequently as they write. They would increase the amount of friction that occurs between the bone and the table. So this friction causes an inflammation and then causes the olecranon bursitis, or bursitis, and this is referred to as olecranon bursitis. And this is basically clinically the name of this syndrome, the disease is called student's elbow. And this would also, just like in my previous videos, I talked about the golfers. Just like I talked to you about in my previous videos, the golfer's elbow and the tennis elbow. And these particular syndromes or diseases are inflammation of the bursa, which initiates and creates a severe amount of pain. Just that, similar to that, we also have this bursa in this in relation with the ulnar, which is called the student's elbow. Like I said, when you write, so the students always write. So when they write, they move their elbow and on the table. As they move along on the table, it increases the amount of friction, and then therefore it increases the initiation of inflammation of that particular area, and that's why we have we have this particular incident, what we call as the student's elbow. Okay, so like I said, this is the triangular posterior surface of the olecranon process, and this is a subcutaneous area, and then we have the olecranon bursa located in this particular area. So this is the posterior surface. On the medial surface, so this is the lateral. I always look at this. This is always lateral, okay? And then just the opposite side is the medial surface. This is the medial surface here. This is the medial surface of the olecranon process. Medial surface serves attachment to certain muscles and ligaments. One of the important muscles is the flexor carpi ulnaris. I think, yes, flexor carpi ulnaris. Flexor carpi ulnaris. And the important ligaments is that the ulnar collateral ligament. Ulnar collateral ligament, there's a triangular ulnar collateral ligament. Let me look at for instance, this is the attachment, the elbow joint. This is the humerus. This is the ulnar on the medial side. So we have this articulation, the elbow joint. What happens is that, so this is the medial side of the olecranon process. So we have a ligament called the medial collateral ligament. We have three bands of the medial collateral ligament. We have the posterior band, anterior band, and an oblique band. So the attachment sites here is the posterior band, and the oblique band attaches to this area. So what happens is that so posterior band attaches from this medial side of the olecranon process, goes all the way to the medial epicondyle. Okay, this is the posterior band. The anterior band, by the way, I'm going to talk about that a bit later. This is the coronary process. So the anterior band attaches the coronary process to the medial epicondyle. It goes like this way. And the oblique band basically connects these two bands together below. So we have a triangular shape ulnar collateral ligament or medial ulnar collateral ligament that stabilizes the ulnar to the humerus, to the medial epicondyle and to the humerus above. So we have, so basically the medial surface of the olecranon process serves as attachment point for the posterior band and the oblique band of the ulnar collateral ligament, while the coronary process here serves as attachment for the anterior band of the ulnar collateral ligament, forming a triangular structure of the ligaments. All right, so this is the medial surface of the olecranon. Let's look at the lateral surface now. Okay, that's the lateral surface, as you can see here. Below that, this area, this particular area here, forms attachment. There's a depression, and there's a muscle attachment here, and uncaneus muscle attaches to this area on the lateral inferior surface of this upper end. The anconeus muscle attaches to this particular area. So this is basically the coronary process. Let's look at the, I'm sorry, this is the olecranon process. Let's look at the coronary process now. Now, coronary process, again, it has the surfaces too. It has the anterior surface, as you can see. Okay, you have the superior surface, you have the lateral surface, and then we have the medial surface here of the coronary process. So if we look at the anterior surface of the coronary process here, the anterior surface going down, it forms a, what we call as ulnar tuberosity. So this area here, you know, on the anterior surface, all the way down here, this protrusion or rough part is referred to as the ulnar tuberosity, and the one of the important muscles, what we call as the brachialis muscle, attaches to this ulnar tuberosity. Okay, so brachialis muscle originates from the humerus and attaches to the ulnar, and this is one of the important muscles that aids in flexion, flexing the forearm. Okay, so it goes like this. So it goes like so. So the brachialis is basically originates from the humerus, the anterior surface of the humerus, then attaches to this ulnar tuberosity. When it pulls it, okay, it flexes the forearm like this, like so. All right. So we have what? We have the ulnar tuberosity here, located on the anterior surface of the coronary process. Excuse me. On the lateral surface, we have this notch called the notch for the ulnar head, the radial notch. Okay, this is called the radial notch, and the head of the radius attaches to this particular area. And let's look at that a bit. So what happens is basically this is the radius. Okay, so the head of the radius. This is the head of the radius. So the head of the radius attaches to this notch here, and this notch is referred to as called the radial notch. And this is really important in that. Okay, let's look at this one here. So we have the head of the radius attaches to the radial notch here. Okay, so the head of the radius is circumferential, is round. Okay, so it fits this radial notch. That's one. Second important aspect, we have the ligament, and it is referred to as annular ligament, and the anterior margin of this notch, and the annular ligament attaches one end attaches to the anterior margin of this notch, and the other end attaches to the other edge or the margin of the radial notch. So basically, it covers the head and connects it with the coronary process or the ulnar notch. And the importance of this is that the circumference of the head basically moves or rotates around this notch here. So what happens is that when it rotates, you would it enables your forearm to be pronated. So so this is the right forearm or right arm. This is the thumb. This is the little finger. Okay. So what happens is that when you pronate, this is the pronation, and when pronation occurs, basically the radius moves over the ulnar, and while it does so, it rotates around this notch here. So you have this pronation and rotation of the head on the ulnar notch. All right. So this is pronation, and this is supination, or medial rotation, lateral rotation, but we usually call it pronation. So this is a pronation, and this is supination. And so you have the ligament around it and covers and strengthens that particular area. So the only action that really occurs would be circular movement of the head of the radius on the radial notch of the ulnar. So that's that. Excuse me. So this is on the medial side of the coronary process is the radial notch. All right. What else do we see on the medial side? On the medial side, we also see, we also see a crest on the medial side. Well, let's look at that in the shaft part. Okay, we can say that. So in the on the medial side, just below the coronary process, a little bit going down on the shaft, we have the supinator crest. This is a supinator crest, and this is the supinator fossa. So basically what happens is the supinator muscle attached to this area. That's about it. So supination, remember? Pronation, supination. So this is the pronation, supination. So supination, pronation, so supination basically comes out from on the lateral side and attaches to the radius. So after pronation, and then supination muscle comes in, attaches here, and pulls it. When it pulls it, it comes back to its normal position, and thus supination movement occurs. So basically, so we have a supinator crest on the lateral side of the coronary process, and the upper part of the shaft. We have the crest here, supinator crest, and we have the fossa here, supinator fossa. So the supinator muscle attaches to this particular area. So that's the lateral side here. On the medial side of the coronary process, on the medial side, we have this sublime tubercle. So you have this tubercle here, protrusion, bony protrusion at the edge of the coronary process. It is referred to as sublime tubercle. This sublime tubercle, two important structures comes out from the sublime tubercle. This is the flexor digitorum superficialis. It is also once referred to as flexor digitorum sublimus. Sublimus means superficial, means muscle or the structure that is located at the higher point, at the superficial aspect. So this is referred to as flexor digitorum superficialis, and it is also referred to flexor digitorum subliminus muscle. Anyhow, so they call this as sublime tubercle. Also, another attachment is the remember I talked about the anterior band of the ulnar collateral ligament. So we have the posterior and oblique attaches to the medial border of the olecranon process, and then we have the anterior band of the ulnar collateral ligament attaches to the medial surface, or on the sublime tubercle of the coronary process. So this is the anterior band of the ulnar collateral ligament. Okay, so that's the coronary process. So that's about it for the coronary process here. Okay, let's look at the shaft now. All right. Shaft. We have three borders and three surfaces. Okay, so in terms of borders, anterolateral posteriors, we have the anterior border, we have the lateral border, and then we have at the back we have the posterior border. Okay, so we have three borders: anterior, lateral, and posterior border. And then we have three surfaces: medial, anterior, and posterior surface at the back. So it's a medial surface, anterior surface, and posterior surface. Three borders: anterior border, lateral border, and then we have at the back the posterior border at the back. Okay. So most of these surfaces and borders are, I'm not going to go into detail, but we have the at the anterior as we have the flexor muscles primarily attaching to these particular areas like flexor digitorum profundus, these flexor muscles. And then at the back we have the extensor and abductor muscles. Okay, we have the extensor carpi radialis longus, for instance, or extensor carpi radialis. So we have the extensor muscles and the abductor pollicis, for example, extensor and abductor pollicis muscles attaching to the posterior aspect of the ulnar. Okay, so let's look at the head. So this is the head of the ulnar, as you can see. All right, and we have two important parts of the head. We have the styloid process. Okay, styloid process on the posterior medial. So this is okay. So if you look at it, so this is the anterior aspect of the ulna, correct? Where do you see the styloid process? It's on the posterior, but it's slightly medially located. So the styloid process is like posterior medially located structure. The styloid process of the ulna, and you can feel it. And also, all right. So let's look at this. So we have. So this is the forearm, all right? So this is the ulna, this is the radius, this is the medial aspect, this is the lateral aspect. And at the back, as you can see, you can see the styloid process. And styloid process is what? Posterior medial, okay? And you have the styloid process of the ulnar, and you also have styloid process of the radius. This is the radius, styloid process of the wrist. So at the edges of the wrist, you can see two pointed areas, and you can feel it if you really. So the lateral part. The medial part is the styloid process of the ulnar, and the lateral part is slightly there is the styloid process of the radius. Okay, so and this is the articular surface here. In this articular surface of the head, you have the articular disc. This articular disc, okay, does not attach to the the head of the humerus, the head of the ulnar, does not participate in the articulation of the wrist joint. But there is an articular disc, but the articular disc do contribute or do attach or do forms certain part of the wrist joint. And there's a notch here, as you can see. There's a notch here, and this notch and the tendon, extensor carpi radialis muscles tendon passes through this notch here. All right. Okay, so one clinical aspect to this is that at the back, if we look at the back, so in a fully extended position, so this is flexion, this is extension. All right. So this is humerus, and this is the ulnar, right? So this is flexion, and this is extension. So extension, so you have the olecranon process going through the olecranon fossa, and then it stops there. So basically, the fossa of the olecranon fossa of the humerus is really important. The depth, the height of the fossa is really important, because if it's more deep, then you would have a hyperextension. So at a certain point, it comes and then stops there. So basically, you extend your forearm and stops there, so you don't hyperextend. So the reason why the hyperextension is prevented is that the edge of the olecranon process basically touches the surface of the olecranon fossa in terms of the height and the deepness of the fossa. So clinically, what is important about this is that you have when the forearm is extended, you have a straight line of medial epicondyle. This is the medial epicondyle, by the way. Yeah. Okay, so this is the medial epicondyle here, and this is the lateral epicondyle, and this is the tip of the olecranon. So we have a straight line. So all these, when the hand is extended, all these three structures are in one line, straight one line. However, when the hand is flexed, okay, when it's flexed, the olecranon, the tip of the olecranon moves away from the fossa. Therefore, you have these triangular shaped structure here. So this is the medial epicondyle, lateral epicondyle, and this is the tip of the olecranon, the posterior surface of the olecranon, tip of the olecranon. So we have a triangular structure here. Okay, so why is this important? This is important when there's a dislocation of the elbow joint, or if there's a fracture of the olecranon process, is that you don't see this triangular or the straight line appearance. So when you look at the radiographs, this should be straight, okay, or triangular. But if there's a fracture or dislocation, this triangular or straight line appearance would be disturbed. And this is also important clinically. Don't forget that. All right. I think that's about it. I covered most of the things that I wanted to cover. All right, that's about it, I believe. Yeah, all right. Okay, one other important thing that I need to also phrase to you is that the lateral border of the ulnar. So this is the lateral border of the ulnar. Okay, so it faces to the radius. So this is the radius, this is the ulnar. This is the medial side, this is the lateral side, all right? So this is the lateral border of the ulnar. The importance of this lateral border is that one of the important fibroconnective tissue attaches, which is the interosseous membrane. And this lateral border is also referred to as the interosseous border. Why? Because the interosseous membrane attaches to this area. So basically this interosseous membrane covers all the way from the distal all the way down to the upper 1/3 of the ulnar and radius. All right, and you have this interosseous membrane. Above that, it's open, and you have the posterior interosseous vessel that passes behind this membrane to the posterior to go to the posterior aspect of the forearm. So basically, you can look at this. You can see the interosseous membrane. Obviously here at this model that connects the lateral border of the ulnar and the medial border of the radius here, and this is the interosseous membrane. By the way, an interosseous membrane, this basically is also considered as a joint, and this is part of syndesmosis joint, and it's part of the it is a syndesmosis type of joint, and it is part of the fibrous joint that we normally classify as semi-movable joints. And yeah, this is the interosseous membrane. That's about it. So that's about it. So thank you very much for listening. And this is I just finally ended this discussion of the ulnar. And I think my next video will be the other bone of the forearm, which will be the radius. And we're going to go over after that with the carpal bones and the hand bones, the metacarpals and phalanges. Okay, thank you very much for listening, and goodbye for now. Bye-bye.